My name is Dr. David Lee Hill. I'm an oral and maxillofacial surgeon in Chapel Hill, North Carolina, and it's my pleasure to talk a bit about a very innovative product that we have been using both in our practice and also in a bone institute where I'm a faculty member for several years now, and that product is called StellaLife. We started using it on more of our complex bone graft augmentation cases. We were using the rinse as an antimicrobial rinse that we typically start 2 to 3 days pre-surgically, and then the patient is able to use that post-surgically. And some of the advantages of the rinse are, again, you do get an antimicrobial effect, but some of the lesser desirable effects such as tooth staining, maybe some change in taste or bad taste, those things are really eliminated with the rinse. But I think the more innovative side of the product is being able to use it as a proactive means. In today's age, anything that we can do to help reduce patient discomfort, also to help avoid, if not eliminate, dependency on opioids following surgery. That's something that really caught our attention, and we wanted to be using anything that we felt was not only state-of-the-art but would be convenient for a patient. So it's easy application. It involves a gel and a spray that the patient is able to use in a very, again, simple manner. And what you'll see is some anti-inflammatory effect and pain reduction. So it's really, I think, all about patient education and having a more proactive and open-minded approach to reducing discomfort, reducing some of the unwanted and deleterious effects of other pain modalities, and at the same time improving healing, improving soft tissue response. So we've been really pleased with it. Our patients have given really good feedback about it, and we're happy to be on board from an early start with this. So I would say kudos to the StellaLife team. I think they're really onto something, and I think that it benefits not just the patients, but I think in the broader sense, we're moving in a better direction with what we can do for folks post-operatively. So thank you.